Hello, I'm Jeffrey Brewer. I'm the president and CEO of JDRF. I'm also the father of a child with type 1 diabetes. And today I'd like to talk to you about the concept of a cure. I'd actually like to ask the simple and provocative question, what is a cure? I think it's a particularly relevant question for us to ask right now as we stand on 40 years of progress in understanding type 1 diabetes, progress towards curing type 1 diabetes, progress in developing transformative treatments for type 1 diabetes. What is a cure? It's a simple question, but I believe it has a very complicated answer that's relevant for our activities today. It's particularly important to define a cure because cure is in our mission. To find a cure for type 1 diabetes is what we're all about. So it's important to define a cure because we need to be clear where we want to end up. Where are we going? Only when we know where we're going can we develop a research roadmap to get us there. And most importantly, a cure must meet the requirements of the patients. It's a cure when the patient says it's a cure. We need to incorporate consideration of commercial viability because it needs to be a business as well as scientifically feasible. And we need to be able to achieve quantifiable intermediate success along the way. We need to show that we're making progress towards a cure. And once we have the description of the destinations where we're going, maybe there are different cures, maybe there are different paths to those cures. We need to be investigating all the different approaches. So at first, I want to talk about a cure from the patient perspective, because I don't think patients think about autoimmunity or beta cells or C-peptide. What they think about is living with the disease on a daily basis. The burden of living with type 1 diabetes, which I would basically put into two buckets. The first is all the stuff you have to do every day in order to live with this disease, all the activities involved in being successful in living with this disease. You have to think about blood sugar all the time, test your blood sugar when you get up in the morning, when you go to bed at night, when you have a meal, when you have a snack, when you exercise, when you're stressed, when you're sick. You have to wear a CGM device, know and think about what your blood sugar is all day long. You have to count carbohydrates. Every time you sit down for a meal, you have to think about nutritional content for that meal before you think about the enjoyment of having the meal. You have to give yourself insulin in the right amounts. You have to administer a pump bolus, an injection. You have to change your infusion sites. And then you have to actually debug this process when it doesn't work as it's supposed to. You give insulin and it doesn't work as fast as it should, or it works too fast. In fact, an infusion site might fail. So many things to think about, so much stuff to do. Then there's another bucket, which is the fear of doing all that stuff badly, because that's real and immediate. If you give yourself too much insulin, your consequences could be sickness or unconsciousness, and in some rare case, God forbid, if no one was around to help, people could die. But then there's the long-term consequences if you give yourself too little insulin. You think about hyperglycemia and the things that a person might have to deal with after living with this disease for many years. All this stuff is too much. Having to live with the disease, think about it all the time, and then having to be afraid that if I don't do that well, then I'm going to have these drastic consequences. That's the way patients think about the disease. So there's another lens that you can take in looking at a cure, which is which physiological state represents a cure. What do you have to do to the body to say that a person is cured? A cure would certainly be restoration of normal physiology, meaning you get away from autoimmunity, you give a person new beta cells and give them the capability to sense glucose, respond, make insulin, and you make sure a person doesn't have complications. At the end of the day, that certainly is a cure we can all agree on. However, some people tell me as I go around the country and talk about a cure that for them, they consider themselves cured if they no longer had to test blood sugar, no longer had to prick their fingers all day long, no longer had to count carbs. Others say, if you made me insulin independent, I didn't have to do injections anymore, that would be a cure. Still others say, also protect me against developing complications. If you gave me all that stuff together, then I'd consider myself cured. But then some hold out and say, well, I really want my body to do what it did before. I want to have a biological mechanism for sensing glucose and producing insulin, as well as the other hormones that don't work properly when a person has type 1 diabetes. Still others might say, I need to reverse the autoimmune process. I need to basically have my immune system work like it did before I had type 1 diabetes. And others might say, I need to reverse all complications that I might have developed by living with this disease for a number of years. So there are different people at different stages of the disease that actually might think about the cure differently. it's also important to think not just what we're trying to achieve in terms of the body, but which therapy would actually deliver that state. So ultimately, what we'd like to have is a one-time short-course drug therapy with minimal or no side effects. A pill or a shot and type 1 diabetes goes away. Everyone would agree that's a therapy that is acceptable in terms of curing type 1 diabetes. But for some folks, they're willing to accept something more in terms of side effects, something more in terms of inconvenience to their life. For instance, people who have debilitating complications such as hypoglycemia unawareness, people who are at advanced state of complications of living with this disease, they might accept islet or whole organ transplant with chronic immunosuppression as a cure. I know people who have had such procedures and tell me that they are cured, and it's not for me to say that those people aren't cured. For them, that procedure has been a cure. Others might say, I'm relatively healthy and living with this disease, otherwise I need to have something that doesn't have the side effects that come with chronic immunosuppression. For those people, maybe an automated implanted mechanical pump, an artificial pancreas, something with a replenishable insulin supply that needs to be refilled, say, on a once every 3-month basis, something that I didn't need to look at on the outside of my body and worked automatically in order to allow me to eat what I want and not have to test blood sugar all the time. Some people tell me that would be a cure for them. What about implantable islets? Maybe the concept that you take pig islets or stem cells and you protect them in a membrane that basically would make sure they're safe from the autoimmune attack. Maybe those islets needed to be replaced in a simple surgical procedure every 18 months. My son actually tells me that he believes this would be a cure for him. Others would say a one shot of glucose responsive insulin on a daily basis, an insulin that only works when the body needs it. Doesn't need to be calibrated with carbohydrates or with blood glucose testing. One shot a day, and I don't have to think about type 1 diabetes. Others say it would have to be one shot a week. I've met people who say that they would be willing to take on a daily basis, say, a couple of pills a day that deal with the immune response and potentially beta cell regeneration. And then others say, if I didn't have to take it every day, but I had to take it, say, once every month or once every couple months and I had side effects, that would be a therapy which would be acceptable in terms of delivering a cure. So there's a lot of variety in terms of the therapy that people will accept in terms of delivering a cure and in what biological state people need to achieve in order to consider themselves cured. This isn't a scientific question. This is a question for the person living with type 1 diabetes. When they are cured is when they think they're cured.